Approximately 50% of cancer patients will experience some sort of nausea. Hey, this is Dr. Dee Grace of the Cancer Detox. You can find us at thecancerdetox.com or on Pinterest, Instagram, and of course YouTube. And the Cancer Detox is all about helping relieve the overwhelmed and overburdened feelings that a lot of cancer patients have as they're going through their treatment process. And we're also all about natural prevention for those who have a family history of cancer and want to prevent it, as well as cancer patients who have survived their first bout of treatment and want to prevent a recurrence. Nausea that occurs in cancer patients is actually quite distressing. Of course, cancer is already a disease that affects the gastrointestinal system, your digestive system. So you want to make sure that you can avoid nausea. Sometimes it's not possible, but this video, I'm going to focus on several tips that's going to allow the cancer patient to try to overcome some of the nauseous feelings that they may be having during their cancer treatment. The causes of nausea are quite varied. It's not only related to the actual chemotherapy that the cancer patient may be receiving, but it also could be due to the radiation treatments, which could be radiation especially to the upper abdomen area, which affects the digestive system. As well, the cancer itself could be causing some of these nauseous feelings, mainly due to the fact that the patient has some metabolic changes, such as hypercalcemia or hyponatremia, as well as any obstructions that may be occurring in the digestive system. So how does one treat naturally nausea that may be occurring while you're on your cancer treatment journey? So before we talk about some of the natural therapies to treat nausea for cancer patients, let's talk a little bit about the drugs that do cause nausea, and they're mostly in the chemotherapy class. And so they would be your carboplatins and your cisplatins. And these drugs were found in a large randomized trial to cause approximately 50% of nausea in patients. So they are well known to cause nausea for those on chemotherapy. You also have another class of drug called the anthracyclines that are known to cause chemotherapy-induced nausea. They found that in a large randomized trial as well, that the number of patients was about 67% that had some sort of nausea reported to the study investigators. So typically, most healthcare providers will provide the cancer patient with some sort of anti-nausea drug, and so this just actually causes the patient to be put on another medication in addition to their chemotherapy, which a lot of patients aren't that happy with. So it's been reported that over 80% of cancer patients are actually seeking some complementary and alternative medicines to help deal with a lot of the side effects of their cancer treatments, as well as the cancer itself. So what natural therapies have some science-based evidence behind them so that you as a cancer patient could hopefully help reduce some of these nauseous feelings and help relieve some nausea as you're going through your cancer treatment journey. Well, the Society of Integrative Oncology, in addition to some very large institutions in the United States, such as Columbia and Memorial Sloan Kettering, have found that acupuncture and acupressure both have fairly good evidence suggesting that those alternative therapies could help reduce nausea in cancer patients. They were actually given a grade of B in their most recent publication, and it's interesting to note that in the same publication that those given a grade of A actually included meditation, mind-body awareness, as well as yoga for helping to reduce anxiety and depression in cancer patients. So that's another tidbit for those who are on this alternative and complementary and alternative medicine path. So the second tip for controlling nausea naturally would be to start moving. So this is important for cancer patients, and I know that, and I've heard that certainly is a hard thing to start doing because the chemotherapy and the radiation can often make you feel fatigued and have a loss of energy. However, moderate intensity, even low intensity, does have some benefits. The first group were enrolled to do moderate intensity exercise. The second group was enrolled to do low intensity exercise. And then the third group, the women did not do any exercise regimen whatsoever. So guess who actually had less nausea and vomiting, improved fatigue, as well as improved fitness levels? It was the breast cancer patients in both the moderate and low intensity exercise groups. So this actually does show that to control nausea naturally, it does require at least some level of physical activity. Now that can include aerobic or strength exercise, as was allowed in this particular study out of the Netherlands. So the third and final tip to naturally help with nausea if you're on chemotherapy is to take ginger. And ginger has been used in indigenous medicine for thousands of years for a variety of reasons, but most well known for helping to alleviate any digestive issues that the person may be facing. Well, there was actually a pretty well designed study, which is a multi-center double-blinded study where both the patient didn't know what dose or what drug they were given, as well as the study researcher didn't know what dose or what drug was given. So these are really considered really kind of the top study designs in clinical medicine. Well, this particular study took over 700 cancer patients and divided them into 4 groups. The first group got 0.5 grams of ginger. The second group got 1 gram of ginger, and then the third group got 1.5 grams of ginger. And guess what the fourth group got? They actually got no ginger whatsoever. They got a placebo, which is essentially a sugar pill or something that kind of mocks the actual ginger itself, so that the patient receiving that placebo did not know that they were actually getting something that had no ginger in it whatsoever. Out of these 4 groups, they found that the lowest groups actually had the most significant reduction in nausea that was reported in the patients taking the 0.5 gram and the 1.5 grams of ginger, which is fantastic. These patients actually started their ginger supplementation 3 days before chemotherapy, and it continued actually 3 days after chemotherapy. The researchers thought that allowing the body to absorb the ginger prior to the chemotherapy, which is actually a great anti-inflammatory agent, helped in the reduction of nausea that was reported by the cancer patients. So these 3 tips, these natural therapy tips, the acupuncture and acupressure, the physical activity, as well as ginger supplementation, are all things that are relatively cheap and easy for cancer patients to do, and should be employed. However, always consult with your healthcare provider before you start any physical activity, especially if you're a cancer patient. Always get the thumbs up and okay from your healthcare provider first. As well, you want to make sure that when taking ginger, it is known to actually be an anticoagulant. So if you are a cancer patient that is going to start some sort of surgery or have surgery done in the coming weeks, you definitely want to make sure you tell your healthcare provider, because that could lead to some potential complications. But it's certainly something you should discuss with your healthcare provider. Thank you so much. This is Dr. Dee Grace with the Cancer Detox. Our mission is to help cancer patients as they go through their cancer treatment journey. Thanks so much for watching this video today. Certainly please like and subscribe, and you can find more about the Cancer Detox at thecancerdetox.com, where our mission is to significantly improve the survival outcomes of cancer patients and also provide the entire public with ways to naturally prevent cancer. You can also find us on YouTube, Pinterest, and Instagram at The Cancer Detox. Until next time.